Hello, I'm Graham Atherton. I work with the National Aspergillosis Centre in Manchester. We have been running this day for maybe 5 years. So I think this is our 5th event. Let's just see if I can get these slides to work. There we go. The relevance, the purpose of World Aspergillosis Day, which becomes a little bit more popular every year. We do a lot of work on social media. We run this event, other people are running events. I'll show you some of those, one or two of those a bit later. Probably a lot of people, there might be some people here who don't know a lot of background about aspergillosis, so thought I should do a quick summary before we start with the main speakers. Aspergillosis is a rare and difficult to diagnose infection, mostly of the lungs. That's mostly because, of course, the Aspergillus, the fungus, releases spores into the air, and we're constantly breathing them in. There are hundreds of, possibly even thousands of species of Aspergillus, but only about 30 of them have the capability to live on or in our bodies. And our bodies are really good at getting rid of the presence of Aspergillus from our lungs, but occasionally somebody has difficulty doing that. It's rare, but it does happen occasionally. It takes different forms. We have an acute evasive form, which is has a longer history of diagnosis and treatment. This relates to people who are really profoundly immunocompromised, so they can't fight off any infections, and that happens normally when they've had their bone marrow replaced during cancer treatment, when they have a blood cancer, for example. So that's acute invasive. That's one form which is fairly well known. The lesser well-known forms are the more chronic forms, which are much rarer, or for the most part much rarer. This centre is specialised to diagnose and treat chronic pulmonary aspergillosis, which is an infection in the lungs, a very slow-growing infection. But there are other forms. ABPA is more of a severe asthma type form for the most part. It's, instead of being an infection as such, it's more of an allergy, so it requires different diagnosis and different treatment. Aspergillosis, there are other smaller, lesser, numerous forms as well, but those are the main three that we talk about. Aspergillosis has a long history of underdiagnosis because it's really hard to spot an infection by Aspergillus. Aspergillus is really quite closely related to us, believe it or not, and to most eukaryotic species. So it's very difficult to tell the difference between us and it when we try and diagnose it. But we have got some really quite good diagnostic techniques now, although we still need better. And the other issue is that there's a lack of awareness. Now, there's a lack of awareness in the medical world, although when we started this process nearly 20 years ago now, there was a big lack of awareness to look for Aspergillus infection, to look for aspergillosis, especially in things like asthma. So we are trying to encourage people to do that, and also the CDC in America have their campaign, which I think I'll talk about in just a sec. And the centre was set up this awareness day really to act as a focal point for everyone to concentrate on promoting awareness events worldwide. The size of the problem, I've only got half a dozen slides here, so it won't take long. Burdens have been estimated worldwide. I've just talked about acute invasive aspergillosis. We think more than 1 million people are affected by that infection. I assume that's each year. Chronic pulmonary aspergillosis, more than 3 million people are affected in the whole world. These are global figures. So, ABPA, the allergic form, allergic bronchopulmonary aspergillosis, more than 5 million people affected. In the UK, estimates are around 100,000 people. And we don't think anything like half of those people have been diagnosed and are being treated as having ABPA. Something called severe asthma with fungal sensitization is a little bit like a lower intensity form of ABPA. That people who have severe asthma, which becomes less manageable, really needs to be, really need to detect the fungal element in that asthma and to start treating that to help them recover better. About 6.5 million people are affected by that. Deaths tragically happen, and we think about the estimate produced by Gaffey.org. It's about 1.4 million people a year are killed by aspergillosis. So it's a pretty big problem. In the world stage of what, 6-7 billion people, it's a small problem, but for those million people, this is a pretty big problem. Who is effective? One of the problems is aspergillosis tends to come as a passenger with other illnesses. So I've just been talking about asthma, and people are treated for asthma and they don't bother looking for aspergillosis. So the aspergillosis tends to get missed. In AIA, acute invasive aspergillosis tends to affect those who are undergoing transplant or people who have cancer. CPA tends to follow COPD, asthma, TB, sarcoidosis, cystic fibrosis. ABPA mostly follows asthma, cystic fibrosis as it worsens, as I've just described. SAF seems to be a progression of asthma, causing severe asthma for some people. And there's something called Aspergillus bronchitis, which is really just an infection of the upper airways, which doesn't produce an allergic response, but still needs treatment. And it's strongly associated with bronchiectasis and COPD. What can we do? We can persuade those doctors treating patients with those conditions that we know strongly associate with aspergillosis to look for aspergillosis. So that's an awareness part of this. We can provide better ways to detect aspergillosis and detect it earlier. So education and research. This is doctors need to be looking out for it, clinicians need to be looking out for it, and patients, if the more patients know, the more they can be prompting these examinations from their clinicians. And we know that works. We need to provide better treatments, manage them better, and overcome resistance. And we'll be hearing talks from speakers shortly in these areas. So it's research is very important, education, awareness, and something called stewardship, which is using the drugs that we have got in the best way so that they remain effective. Inform and involve patients during diagnosis and management. After all, they have direct interest in improving their own quality of life. So we have, for those patients we provide, they need support, they need resources, and they need encouragement to ask questions. And in this team I lead here in the National Aspergillosis Centre, those are some of our major tasks. In the US, the CDC have their Fungal Awareness Week, which is usually in October. Pretty much the same message, encouraging doctors in particular to be aware of fungus and think of fungus when their patients are not getting better with treatment. The quicker doctors can diagnose the right illness, the quicker patients can be treated in the right way.